actually I can do it right here. So what you do is you lay on the floor into a doorway or into a room, and so you put your buttocks are really close to the door frame. And then you take your foot and you put it a little bit outward of the body, and the knee points out of my shoulder. So it's out at about a 15 to 20 degree angle. And I don't feel an upward tension, so I need to scoot down more. So I scoot into the room a little bit more, and now I feel this definite pull through my thigh, pulling that pelvis upward. So this is something you can do once a day for 5 minutes, and you do it for a week, and then you do it once a week thereafter for about 6 weeks.
Is it going to be harmful if I do it like every day for the rest of my life?
No, because it's not a large passive force.
Okay.
It's not a harmful amount of energy. It's not a quick, abrupt, forceful injury. It's a really gentle stretch.
Okay.
So you're not going to cause it to go the other way. You're not delicate. Your structure is very strong. So you don't have to worry about that.
Okay.
So can you tell if you feel any different? Can you move around a little bit?
Yeah, I felt it on the table when you were, I could feel the difference when you were pushing.
Okay, you could feel, what difference did you feel?
I could feel the movement, like it felt a little, like I could feel in the beginning I was stuck, and then I felt it moved. Yeah, my foot feels different. That's what feels different. Like it definitely feels.
Interesting. So when you're walking, you feel like the foot plants a little differently?
Yes, I feel like my foot plants differently.
And we discussed that. And when you first walked, I said, you look like a rear foot supinator.
Yeah.
And then I screened your foot, ankle, and subtalar joint, and I made the comment that your ankle is strong, it's very mobile, and then I speculated after finding the downslip that it was the pelvis driving the foot, and that the foot and ankle was fine. So that comment is very, very interesting, that you feel different in how the foot plants when you walk now.
Yeah, it feels that's what feels different. My foot.
So nice to know we can treat the foot by treating the pelvis.
Yes.
Anything else you care to add?
No.
Well, downslip ilium is underdiagnosed, it's underappreciated, and it's undertreated. And I have a large number of YouTube videos on the topic of downslip as a type of sacroiliac joint dysfunction. And whatever it is, we can't look inside your body when on the table. We can't do three-dimensional filming and
Not yet.
You know, not yet. So we can't validate that that is in fact what happened inside the joint, but you could see the behavior of the structure, and you could see that the properties of the structure were altered for the better, obviously for the better. And so I think that downslip is a valid construct. You know, is it really a form of sacroiliac joint dysfunction in which the ilium moves on sacrum? We don't know. You know, it'll be a long time before we can say yes or no. But my point is, rather than run from the controversy and say, oh, there's not enough research, I'm not going to touch it, I'm not going to look at it, I embrace that knowledge gap. And I'm more interested in solving problems. And on the first page of my website, at the very bottom, is a young man, Jordan, and this was in 2010, and he couldn't walk. He was being homeschooled because he had a downslip ilium. He'd put a cane in front of him and hop like a bunny. I'm like, why do you do that? He said, it hurts. You know, kids, they're so honest. And I just want to say that downslip ilium, it's worth paying attention to. That's my belief. Thank you.